Optimizing your health. How intermittent fasting and hormone balance can prevent diabetes. Richard McQuenty, RPMD, PhD. Are you searching for a natural approach to the starvation of diabetes and the improvement of your health? Intermittent fasting is an excellent way to naturally balance hormones, regulate blood sugar levels, and lessen the danger of developing diabetes. By combining intermittent fasting with healthy dietary habits, one can take charge of their well being and minimize the risk factors associated with diabetes. In this blog post, we shall consider how intermittent fasting in combination with hormone modulation may help deteriorate the symptoms related to diabetes. Additionally, we will study the advantages that come from embracing periodic abstinence, as well as analyze how it works hand in hand with balanced nutrition, so as to maintain ideal concentrations of glucose within our body fluids. Finally, various modes are presented that could be utilized in order to incorporate both into one's daily occupation for attaining utmost wellness, along with obviating development or manifestation signs concerning potential onset or exacerbation stages diagnosed by medical experts relating back to any form linked directly to diabetes mellitus disorder. Understanding the basics of intermittent fasting. Recently, intermittent fasting, as in case, has become a widely adopted dieting technique for the purpose of weight loss, and it is well justified. It is believed to be an effective method to decrease body fat levels and promote general well-being. However, what exactly constitutes intermittent fasting? What role does this practice play when it comes to diabetes prevention specifically? Intermittent fasting necessitates alternating cycles that involve both eating periods as well as abstaining from food consumption. These time frames usually last anywhere between 16 and 48 hours in duration. When one fasts, stored fats will likely provide more energy than typical meals from everyday food sources. Intermittent fasting offers numerous benefits for both physical and mental health. It has been shown to reduce body weight and improve metabolic markers, such as insulin sensitivity and cholesterol levels, while also balancing hormones that are key components in diabetes prevention, namely ghrelin, the hunger hormone, cortisol, the stress hormone, and leptin, sarcomama. Ghrelin sends a signal to the brain when one is hungry. Cortisol increases during times of stress, and leptin signals the brain once a meal has been eaten, thereby inducing fullness. When these hormones become imbalanced, it can lead to overconsumption, which may contribute to type 2 diabetes as time passes if not monitored properly. Intermittent fasting has been suggested as a means to balance hormones, which play a key role in preventing type 2 diabetes. So how does intermittent fasting actually help with hormone regulation? As people fast intermittently, the release of ghrelin is reduced because there is no longer an active need for one's body to signal hunger, since food intake at that particular time period becomes unnecessary. Additionally, cortisol levels also decrease due to the lower stress associated with not having to plan meals and snacks throughout the day. Consequently, these become irrelevant during periods where individuals observe if protocols such as 16 height or 24-hour fasts on either a once per week or twice per week basis, respectively. Furthermore, leptin production increases through decreased caloric uptake, which leads to decreased calories being stored by fat cells over time, due partially to the challenges posed by the aforementioned if strategies. To summarize, intermittent fasting can be deemed effective when it comes to balancing hormones responsible for warding off type 2 diabetes, as its primary function lies in its ability to regulate triggers related to appetite control, while providing additional metabolic benefits like increased insulin sensitivity arising out of a lowered amount of consumed calories for a few days within a given week. The link between hormone balance and intermittent fasting. There is a strong link between hormone balance and intermittent fasting, even though it may not seem that way at first. Intermittent fasting can be advantageous in maintaining healthy levels of hormones in the body, which have an impact on general well-being. Hormones are responsible for controlling metabolism, hunger cravings, and blood sugar. When these become imbalanced due to chronic dieting or excessive consumption of food, diabetes increases its chances of developing. Evidence has demonstrated that through intermittent fasting, inflammation decreases and glucose tolerance improves, thus assisting with hormone regulation. Intermittent fasting involves a pattern of alternating between eating and not eating over a certain period. For instance, some opt to fast for 16 hours each day by omitting either breakfast or dinner. Research has shown that this type of intermittent fasting is advantageous when it comes to weight reduction, as well as stabilizing blood sugar levels in individuals with type 2 diabetes. Aside from aiding in the regulation of hormones associated with metabolism and appetite control, intermittent fasting also increases the production of growth hormone COW, which is pivotal for tissue repair and muscular development. It has been determined that having a balanced hormone level is integral to keeping the body healthy, as it allows for insulin sensitivity, which in turn permits cells to absorb glucose correctly and without becoming resistant. A lack of this balance can lead to diabetes if left unchecked. Intermittent fasting serves as an effective tool when attempting to regulate hormones, reducing inflammation caused by high cortisol levels as stress-related hormone, while simultaneously aiding in increasing healthy insulin sensitivity so that cellular absorption of glucose will be more efficient. And there will no longer be any form of resistance present, ultimately decreasing the likelihood one may develop either diabetes or other metabolic diseases related to hormonal imbalances, such as obesity or polycystic ovary syndrome (PCDO). Research has demonstrated that intermittent fasting not only facilitates the regulation of hormones, but also offers numerous health benefits. Studies indicate it is capable of reducing oxidative stress, which is damage caused by free radicals, while increasing production of proteins with anti-aging qualities such as sirtuins, which can help protect against age-related illnesses like Alzheimer's disease and Parkinson's disease. This practice aids in protecting heart health due to its ability to lower bad cholesterol levels while raising good cholesterol figures. Another important element for averting cardiovascular issues, including strokes or heart attacks. To conclude, intermittent fasting serves as an optimal tool for both maintaining hormone balance and preventing diabetes simultaneously. Role of blood sugar levels in diabetes prevention. The relevance of blood glucose concentrations to diabetes prevention cannot be overstated. Most individuals are unaware that their level of sugar in the bloodstream is linked to their probability of developing diabetes. Elevated levels of blood glucose can bolster the probability of a person getting type 2 diabetes, while lesser amounts will bring down this risk. Fortunately, there exist multiple methods that enable one to maintain healthy values of blood sugar and avert contracting diabetes, such as intermittent fasting and balancing hormones. Studies have established a correlation between intermittent fasting and increased insulin sensitivity as well as improved control of sugar levels. Intermittent fasting necessitates alternating interludes of consuming food and abstaining from it over defined time intervals. It has been observed that when implemented systematically and properly, intermittent fasting can minimize resistance to insulin by heightening the body's capability to draw on glucose for energy instead of storing it like fat. Additionally, regular, periodic abstinence helps regulate hormones such as ghrelin, the hormone related to hunger, which impacts our appetite, metabolism rate, and overall well-being significantly. A crucial component in efforts to prevent or manage diabetes via diet and lifestyle modifications is hormone balance. Of particular significance is the role leptin, a type of hormone, plays in regulating our energy equilibrium by controlling appetite cues, as well as exercising an influence over how we store up fat. Studies have revealed that individuals with type 2 diabetes typically present higher levels of leptin than those without the condition, which is attributed to increased production from fat cells. As a result, they may be more prone to indulging in continuous eating or overindulgence throughout the day on account of their heightened appetite signals stemming from a disruption in leptin equilibrium or resistance. Furthermore, further hormones such as cortisol are linked with augmented body mass gain due to exacerbated stress-driven cravings, which then amplifies an individual's susceptibility to cultivating type 2 diabetes if not addressed promptly and effectively. Henceforth, preserving hormone balance through dietary transformation combined with suitable exercise routines can significantly aid in avoiding or controlling prediabetes states leading up to thorough TTDM manifestation. How intermittent fasting affects insulin sensitivity. Intermittent fasting is a simple and effective way to enhance insulin sensitivity. This form of fasting necessitates alternating bouts between consuming and abstaining from meals for an allocated period. Research has demonstrated that it can reduce the risk of diabetes by amplifying insulin sensitivity, which embodies the body's capability to react with insulin in order to control blood sugar levels. Subsequently, this strategy does not involve any kind of caloric limitation, thus making it an optimal approach for those who wish to preserve their weight while at the same time achieving improved health benefits. Studies have revealed that intermittent fasting can improve glucose tolerance by allowing the cells to employ glucose as fuel rather than store it in fat form. This renders the body more proficient at managing how much of this essential compound is available inside our bloodstream at any given instance, and thus keeps blood sugar levels within a safe range while lessening the likelihood of diabetes development or advancement. Furthermore, research has suggested that such dietary practice additionally bolsters insulin production and receptor site responsiveness, both in muscles and adipose tissue. Periodic fasting has also been observed to help reduce inflammation within the body, which can play a role in diabetes development or progression due to its ability to trigger oxidative damage throughout multiple systems such as the endocrine system and immune system. By reducing inflammation through intermittent fasts, these processes are better regulated, resulting in enhanced functioning capabilities of our bodies when it comes to managing diseases related to hormones like diabetes or obesity-related illnesses that often accompany the diagnosis of diabetes. Furthermore, research has indicated that intermittent fasting may be beneficial in the reduction of cravings for unhealthy foods associated with overeating or binging on sugary items, which can potentially result in an increased probability of developing type 2 diabetes due to excessive weight gain over time when combined with unbeneficial lifestyle choices, such as a lack of exercise and physical activity, along with inadequate dietary habits, comprised mostly of processed food products containing high glycemic index carbohydrates like refined breads, rice, pasta, etc. Consequently, this sort of diet assists people in preserving healthier lifestyles, generally, thus resulting in improved well-being free from disorders and complications, including those related to type 2 diabetes and other illnesses connected to obesity over the long term. Impact of hormone imbalance on blood sugar management. The significance of hormone discrepancies on blood sugar regulation is apparent, and this can bring about a range of health troubles for those who are vulnerable. When the hormones that control blood sugar become misaligned, it becomes difficult for the body to organize its sugar levels. This could provoke an increase in insulin manufacture, as well as an inability to proficiently metabolize carbohydrates. Therefore, individuals may encounter indications such as weariness, amplified thirst and craving, weight gain or loss, frequent urination, and hazy sight, if left unchecked or ineffectively managed. These indications could possibly point to prediabetes or full-blown type 2 diabetes. Investigation has demonstrated that intermittent fasting aids in managing glucose by diminishing stress hormones such as cortisol, which can compromise the body's capacity to properly respond to insulin cues originating from nourishment. When cortisol is released due to anxiety, it causes a spike in sugar levels and further hampers the body's blood sugar regulation over prolonged lengths of time. Intermittent fasting offers an approach to those who are endeavoring to regulate their diabetes through dietary control and exercise by offering them periods of time where they do not have access to food, thus diminishing the demand for insulin production during such instances, which assists in keeping glucose levels more stable over a period of time with less effort than if constant consumption were occurring throughout the day without breaks from eating. It is essential to maintain proper blood sugar regulation through the balance of hormones within our bodies, as an imbalance in one hormone can affect how other hormones work and consequently impede glucose levels. Thyroid hormone plays a role in carbohydrate processing. Therefore, balanced thyroid function allows for better control over glucose metabolism, which helps manage diabetes either by diet alone or with medication when necessary. Hormonal imbalances cause prediabetic states, but they may not always lead to full-blown type 2 diabetes. There could be genetic factors that make treatment harder, but hormonal balancing should still be a part of any treatment plan because all hormones affect metabolic functions, such as energy production linked to carbohydrates that affects overall glycemic response rates. Healthy eating guidelines during intermittent fasting. It is of utmost importance to adhere to healthy eating habits when engaging in intermittent fasting. Following these guidelines will ensure that the body stays nourished and balanced while one practices this lifestyle change. A beneficial rule for those pursuing intermittent fasting would be to prioritize nutrient-dense, whole foods that can maintain stable blood sugar levels throughout the day and offer protracted energy sources. It is essential to consume a well-balanced diet in order to stay healthy. This includes incorporating plenty of fruits and vegetables, lean proteins such as fish, eggs, nuts, and seeds, complex carbohydrates like quinoa, oats, or sweet potatoes, and healthy fats, including olive oil or avocados. Even if you are following an intermittent fasting approach, it is critical that regular eating habits be followed throughout the day with a minimum of 3 meals, while snack choices may also factor into the equation depending on how long your periods between feasting last. Eating regularly every few hours helps lessen feeling famished, along with providing reliable energy for any physical activities during those times too. Furthermore, ensure each meal contains protein, which supports maintaining good metabolic function over time and aids hormone balance within the body, thereby diminishing risks associated with issues such as diabetes-related obesity or insulin intolerance. Case studies showing diabetes prevention through intermittent fasting. Recent years have seen intermittent fasting increase in popularity as an approach to losing weight, promoting health, and even extending life. However, were you aware that it can also be used to avoid type 2 diabetes? There is a steadily growing body of evidence exhibiting the effectiveness intermittent fasting possesses as a means to prevent diabetes. A particular study, appearing in the periodical Cell Metabolism, studied people exposed to prediabetes, which is medical terminology for those more likely than others to develop type 2 diabetes who practice alternate-day starvation. The results of the research were promising. After only 3 weeks, those partaking in alternative day fasting demonstrated significant declines in their insulin resistance and other markers associated with the metabolic syndrome, a set of indicators linked to diabetes risk. Furthermore, these advantageous shifts continued despite the participants ending intermittent fasting practices once they had concluded. Additionally, a study published by Diabetes Care revealed that temporary fasts lasting 16 to 24 hours improved glycemic control among people with type 2 diabetes without any adverse effects being reported. Following merely 8 weeks, such individuals exhibited considerable drops compared to those who did not practice this type of abstention from eating, implying regular periods when food is not consumed may aid in reducing inflammation and oxidative stress, both major contributors towards chronic conditions like type 2 diabetes, as well as help increase glucose tolerance and sensitivity, which are essential for keeping one's blood sugar levels regulated while avoiding dangerous surges or descents in blood sugar concentrations over time if left unchecked. Potential risks and side effects of intermittent fasting. Intermittent fasting has become an increasingly prevalent dieting strategy that appears to be effective for both weight loss and health improvement. Nonetheless, similar to any dietary regimen, there are potential risks associated with it, such as side effects or long-term medical implications. Despite the fact that most people who practice report no negative reactions related to their fasting routine, certain individuals may experience difficulties determined by their individual physiology and medical history. The probable dangers of intermittent fasts can vary depending on the type of fast being done and one's particular situation. Those at higher risk, including pregnant women, people with diabetes, individuals taking certain medications or supplements, and those who have a history of eating disorders must consult their doctor before commencing any new diet plan or lifestyle modifications. Even healthy people ought to be aware of the potential side effects they could experience when initiating an intermittent fasting program, such as hunger pains, lightheadedness, changes in mood, impaired sleep quality, dehydration, low energy levels, muscular aches and fatigue, nausea, and stomach discomfort. Moreover, one should also take into account how if diets may influence hormone balance within the body along with their effect on diabetes risks, like blood sugar control and insulin sensitivity. Although studies point towards if assisting in improving metabolic markers, which potentially reduces someone's risk of developing or worsening symptoms related to diabetes over time. More research is still necessary concerning this topic prior to coming up with definite conclusions about its effectiveness for diabetics specifically. Practical tips for successful intermittent fasting. Intermittent fasting is a potent instrument that can aid in the regulation of hormones and the equilibrium of blood sugar and stave off diabetes. Despite appearing contradictory to fast when trying to be healthy, there are numerous benefits associated with intermittent fasting. Intermittent fasting might assist by improving insulin sensitivity and decreasing levels of the hormone ghrelin hunger hormone. Adhering strictly to this method could also serve as an effective means for reducing body fat, which is connected with type 2 diabetes. There are a number of different types of intermittent fasting that can be practiced, including 12-hour fasts or 16-hour fasts, in which the eating window is restricted for those hours while still consuming all necessary calories within that time frame. Additionally, people may opt to undertake alternate day fasting, wherein only eating occurs every other day. A further option is 5-2 intermittent fasting, where it is routine to eat normally 5 days a week, and then restrict calorie intake on 2 days out of the week, consuming approximately 500-600 calories during these 2 days. Therefore, how does this practice work? It all boils down to the concept of hormesis, wherein mild stresses in minute quantities can provide an adaptive response within the body and bring about greater well-being overall. When done appropriately, intermittent fasting aids in bettering glucose control by making cells more responsive to insulin during times of food limitation, thereby decreasing the risk of type 2 diabetes over time. It is essential not to take excessive measures when engaging in any kind of dietary restriction, since it could have detrimental effects on one's health if performed incorrectly. Notwithstanding, there are certain viable tips that should be followed while undertaking intermittent fasting, such as heeding the body's hunger and fullness indicators and adjusting accordingly. Scheduling meals around physical activity levels, consuming a sufficient amount of water, obtaining enough sleep, abstaining from processed foods, including healthy fats in meals, refraining from consuming snacks between meals, concentrating on whole foods, etc. If these tips are adhered to, you will be able to set yourself up for success during your intermittent fasting journey. Moreover, short durations of caloric restriction activate autophagy, a procedure whereby damaged components within cells are recycled and exchanged with new ones, which enhances total cell healthiness as well as function over time. In conclusion, it has been observed that intermittent fasting is correlated with improved hormone balance, which can assist in preventing diabetes and regulating blood sugar levels by combining intervals of not eating with good nutritional practices. One can take advantage of both approaches to benefit themselves and stave off the onset of diabetes. If you are searching for a compounding pharmacy that can assist you in getting the most out of your medication, then look no further than Pharmaprodia Compounding Pharmacy Group. By consulting Dr. Richard Nakarian, PhD, ABP, with this group, one will be able to get started on their journey towards improved health promptly and properly. The said doctor is an expert pharmacist who has mastered providing cutting-edge compounding services covering a vast range of medical requirements, from straightforward prescriptions up to complicated medical problems. Nkwetni's team possesses sufficient experience as well as knowledge to aid them in developing customized medications, ideally suitable for each patient's exclusive demands and objectives, safely, effectively, and securely. With his expertise, he can help you achieve optimal health through customized medicines made according to your specifications. Thus, there ought not to be any obstruction when it comes to proceeding ahead. Contact Pharmaprodia Compounding Pharmacy Group today so as to talk with Dr. Richard Nkwenti, REFP, MBRG, immediately concerning embarking on your voyage toward better well-being.